Hi, everyone. Can folks hear me?
Yes.
Great. We don't have too many updates, but just a few. So we're up to 559 cases total of New Haven residents that have been tested positive for COVID-19. We're seeing that number rise pretty steadily every day and anticipate that there's a lot more cases out there. There are also 15 fatalities total. Um, I wanted to, before I hand it over to Mike Piscatelli, who had some updates, I did want to highlight something that I think is very important to underscore. There's been some comments about opening up the economy. And while all of us would love to say that now is the right time to open up the economy, the medical experts are saying that that is absolutely the opposite thing that we need to be doing right now to protect our residents, the health of the people, and to make sure that the virus does not spread. And so I'm discouraged to hear that some people are saying and promoting the idea that just around the corner we're going to be able to reopen a lot of stores and get back to life as normal, because I think that's deeply irresponsible. It's so important that we stay the course, that we keep social distancing. Given that New Haven cases are rising every day, now is not the time to ease up on those restrictions. Now is the time for everyone to concentrate on making sure that we stay the course so that we reduce the spread of the virus. Given that tomorrow is Easter Sunday, the weather's getting better, and that people understandably are anxious for that time when we will get back to normal life. I think it's very important for all the leadership to emphasize that in the long run, for the economy to be strong, we need to make sure that now is not the time that we focus on reopening, but rather the time that we focus on keeping hunkered down and staying at home and staying safe. I wanted to pass it on to Mike Piscatelli. He had a couple updates about Together New Haven.
Well, good afternoon, and thank you, everyone. Thank you, Mayor. And to the Mayor's point, one of the things we're doing with our daily e-blast is reinforcing the significance of what we're going through on the pandemic side, and encouraging both best practices for people that are open and for some sense for the duration of this, so that we're planning and using this period wisely so that when it is time to reopen, we come back strong. To give you a sense, we had briefed you once previously about the Together New Haven program, which is a broad effort with a number of partners that is intended to both work with businesses through the pandemic, flatten the curve together, stay connected over this long period of time, provide the right technical and financial support that people can survive and be strong coming out of this. One of the key programs that we launched was the program on the creative side for creative artists and freelancers, so that these were mini grants done in conjunction with the Arts Council. We've awarded now 146 grants. Those are out the door. We have another 67 that are on a waiting list, and we're hopeful to get those out as well. We're also looking forward to a launch this week or early next of Town Green's digital marketplace and the support services they're doing to get more businesses online. We've done a number of webinars in conjunction with the Chamber. Westville did one on Friday to support folks that are freelancers to get into the payroll protection program. That was the first opportunity on Friday for people that are freelancers to get into payroll protection. It's a very important webinar. We're very grateful to the folks in the Westville Village Association led by Lizzie Donius, who did that webinar. On Wednesday, we're going to do one with Fred McKinney. That's at 2 o'clock this coming Wednesday. And we'll talk about the new program that was launched by HEDCO. HEDCO is giving out $20,000 grants, lines of credit for working capital. And those are specific to minority-owned businesses. So a real important niche in the marketplace that we're going to be supporting with a webinar on Wednesday. And then I'm going to leave you with, if I can show it up on the screen, one of the key parts of Together New Haven is supporting local businesses that are doing the right thing to either go online, order delivery, or takeout in a very responsible manner. And we're very pleased that Ricky D's joined the program today. Those of you on the call, you'll remember Ricky D from joining as one of our first graduates in the small business program, opened up a brick and mortar storefront at Science Park, and just last week installed plexiglass between the counter and the customer to better protect customers who go in for some of the very best barbecue in the region. You could support Ricky D online, buying a gift card, or again, by getting takeout from him. And it is probably the best picture in our program, Mayor, so I thought it was a good one to share today. Happy to answer any questions.
Thanks, Mike. And usually it's hard to tell in the conference calls whose dog is barking, but everyone else was on mute.
That was Lola, off the record.
Does anybody have any questions?
Hey, Mayor. It's Dave Altamari from the Hartford.
Go ahead, Dave.
I was just curious, do you know at all if they've had to use the facilities at Yale for patients yet, or if the numbers are still okay at hospitals, that they haven't had to bring anybody there yet?
My understanding is they haven't had to need it or haven't needed so there's two things going on at Yale. One is at the Landman Center, and that is in collaboration with Yale New Haven Hospital as a site for to provide additional beds. The second thing at the university is 300 rooms that they are working to make available for first responders. My understanding is that they have not yet used the Landman Center. I'd encourage you to confirm with them that information. They were not on our group call today, and we usually have a daily group call with our regional partners. We did have one firefighter that was in the university's dorms for a period of time. That firefighter is no longer there. I believe that another town had another public safety individual in one of those rooms as well, but that's something that I would ask you to confirm with Yale before reporting on, just to make sure it's accurate.
Okay, thank you.
You're welcome. I see Sam's hand up.
Yes, thank you. I have a question for Mike Piscatelli.
Yes, ma'am.
The grants, you said were already awarded and some more going out the door. Could you just talk a little bit more about what those can be used for?
So those are direct assistance to artists, performers, anyone in the creative sector here in New Haven. So it's broad eligibility for what it can be used for. We've encouraged people to use them for technical assistance and strategies so that they can ride through the shutdown period when they can't perform maybe in public, and also for skill building. So you can use these grants to take a class online, to build your skill set up before you are, so use the period appropriately when you can't be out performing to build a technical skill.
And how are they awarded?
Those were a selection process that was done in partnership between our Department of Cultural Affairs and the Arts Council. There was a small selection committee. One of the key criteria was to pick artists who met the ALICE criteria for income.
I see. And then for you, Mayor, I'm just wondering if there are any updates on cases in nursing homes, if there are more today that you know of.
The short answer is no. I don't know if Director Bond, you have any information, more information on nursing homes that you want to share?
Not at this time.
Okay.
Thank you.
You're welcome. Other questions? Go ahead, Mary.
I guess no other updates on agreements with Yale. You're still working on that.
Still working.
Still working. And nobody added to the your own center, your own emergency center.
Still
cases.
two people.
Okay. Nothing on firefighters or police officers.
The latest numbers are 10 firefighters are positive, and the police is the same, 4.
Okay. And so are you continuing, I know you continually stress this, but the message to everyone to stay on board, stay home. It's a holiday tomorrow. Don't enjoy it at your own house.
Yeah,
so
I mean, go ahead.
Are you getting a lot of feedback from the business community, from people? I mean, pressure that, this is the time to do something different.
So we have gotten feedback that I think all along that this is a real sacrifice that the businesses are making. We have not received a lot of feedback of yet of businesses that are disagreeing with what the city's policies are. However, there's been a little bit of messaging around the state, and definitely messaging from Washington,
Mhm.
that are out of touch with what epidemiologists believe is the right course of action here. And my concern is that people in leadership roles pushing out a message that things might be getting better already, when this is exactly the time when it's most important for people to stay inside and practice social distancing. My concern is that that sends the wrong message and creates some uncertainty and disagreement in the public about what people should actually be doing. Frankly, I'm grateful that most people in New Haven don't always take what comes from Washington at face value and are skeptical of some of the messages. I think that by and large, New Haven residents have been on target and focused. But I do think that it's the responsibility of all leadership to continue to remind people just how important that is, and that this is the advice of medical experts as well.
Thank you.
You're welcome. Other questions? Go ahead, Sam.
Is that smaller health clinics are, see, it says I'm muted. Can you hear me?
Yeah, I just unmuted you again.
Okay, okay.
Smaller health clinics is all I heard.
Yes, smaller health clinics in Connecticut and all over the country are struggling right now because their visits are down. And I'm wondering if the city is partnering with any of them. Of course, there's the hospital, but there are also a lot of other medical professionals in the city who may not be getting the same revenues that they're used to. Maybe that's a question.
And Director Bond can chime in as well, but we've been working quite closely with the Fairhaven Health Clinic and Cornell Scott, and have been very, very grateful for their support. They've actually been on the front lines and been helping out a great deal. So Fairhaven Health Clinic has an outpost at Bella Vista, and they've been testing residents at Bella Vista that are symptomatic, and have been collaborating with us to make sure that residents at Bella Vista also have telemedicine so that they can provide any medical advice and resources to residents there. Separately, both Cornell Scott and Fairhaven are working with the New Haven Housing Authority to provide telemedicine and testing for residents in many of those facilities. And I'm deeply grateful for the support of trusted partners that understand the approach that is correct for addressing issues around COVID-19, and have also the credentials and relationships in the community to allow us to both share our messaging of what's important, but then also to be the messengers back to us so that we can understand in a deeper way what's going on in the community. I don't know if Director Bond, you want to add anything to that? No?
That was great.
Okay.
Thank you.
You're welcome. Other questions? Go ahead, Mary.
Just a follow up to that, is that a whole new program that the clinics are going into the Housing Authority and testing, and they have the test for the coronavirus?
So, So I think you asked a good question. I think what's happening with COVID-19 in our response is that we've had to get innovative in addressing the community that we're serving. And so both community health centers are identifying and addressing a gap within the community that the mayor just mentioned. And so we're just very glad to know that that both community health centers are building capacity and then also ensuring access to healthcare through the telehealth model.
And yes, it is. It's building on their existing programs. So for example, at Bella Vista Fairhaven, Health has for a long time provided support for some Bella Vista residents, but they've opened up their services to all Bella Vista residents. They, starting this Monday, will be providing that support for housing authority for, it's around like 7 housing authority properties. And Cornell Scott also has a relationship with a lot of residents in the housing authority buildings, but they're expanding their telemedicine services and testing to a larger group of residents.
Okay, that's new. I mean, I knew about the Bella Vista UNASA before, but this is new with Cornell. And also, they have the test. I mean, that was a problem for some groups, but they have.
Correct. They've been doing some tests. On our call today, I believe Cornell and Fairhaven are around 200 tests total that they've done over the past 4 weeks or so. You should confirm with them those numbers, but it's in that range. But when you think daily, that's not a lot of tests. Their limitation is some equipment, for example, swabs to conduct the tests. They don't have a lot of that equipment. And so at the moment, it's pretty limited. We have had some conversations with them about capacity to expand the number of tests, and they're open to finding ways to collaborate.
Okay, so is Fairhaven doing all right with swabs?
I think that that PPE and materials for testing is consistently a struggle with all entities. And the PPE is important as well, because technically people should be changing PPE in between tests. And so you can, if you're doing a lot of tests, you can pretty quickly run out of PPE.
Right, okay. Thank you.
You're welcome. Other questions?
Hey, Mayor.
Go for it.
Hi, how are you?
You mentioned testing. I think one of the governor's recent press conferences, he mentioned that New Haven was going to be one of the test sites for the Abbott, the 15-minute test. Do you have any more idea on when that may start or what the deal is with that?
So I think that you should refer the question to the state. We have been in conversations with them, and they have made it clear that they want one of the facilities to be in New Haven, which we're very happy about because it will provide access to many people in the region. I know that this has been done in several other states, and that testing and followed by contact tracing is one of the keys for us being able to, in the long term, manage the virus. As far as the details, I know that they're ongoing and trying to determine and finalize the site, how many people will be tested a day. I also understand that the test is, the turnaround time and the test is very quick. It's something around 15 minutes. And so the value of that turnaround time is pretty important. The accuracy of the test, I've heard some mixed reviews on whether it's fully accurate, and that's something that I think that we should just be aware of as this plan moves forward.
So no sense on when that could start, or that seems like it's still kind of in the development stages?
It is. I know that they're anxious to get it started. I would ask them for more details. It's their project. We're trying to help facilitate it, but I prefer it if you ask them for the details.
Okay, thank you.
You're welcome. Mary, you had another question?
It doesn't, it's not connected with Yale. I mean, this is totally separate with Abbott. Abbott
Correct.
is a standalone.
Correct, totally separate.
Are other cities or sites in contention with New Haven, or is New Haven it's just a matter of where they will place it in New
I
Haven?
think they were going to place 2 sites around the state, and one of them will be New Haven. I'm unclear where the other site is going to be.
Stanford is the second site.
Stanford, okay.
Stanford, okay, thank you.
Other questions? We are going to take 2 days off from press conference, but you all have my cell phone. If you have any questions, feel free to call me, 203-500-2969. Okay?
Thank you.
Thanks, everybody. Take care.
Happy holiday.
Yeah, happy Easter.
Happy Easter.
Thank you, Mayor. Happy Easter.
Happy Easter, everyone. Thank you.